All right, Chike, thank you. Well, according to data from the CDC, every 40 seconds, someone in the U.S. has a stroke. By the time, in fact, we finish this next interview, roughly 6 people will have had a stroke. Obviously, the goal is to lower this number significantly. Dr. Chike Ilorah, a neurologist with Brookwood Baptist Health, joins us this morning with more. Doctor, good to have you with us.
Thank you for having me.
Let's start with just essentially explaining what is a stroke and the different forms of a stroke, if there are different varieties of a stroke.
So there are two main types of stroke. One is the blockage type of stroke, where the blood vessel that supplies the brain gets blocked, and that is the type we call the ischemic stroke, and it happens in about 80% of the time. And the other type is the bleeding type of stroke, called the hemorrhagic stroke, when there's a rupture of the blood vessel that supplies the brain. So when this happens, you have damage of the brain, which can now manifest with symptoms.
Before we talk about the symptoms, after much research, I'm sure, into this, have we learned what causes that, what triggers that for someone to have a stroke?
So there are so many risk factors for stroke, things like smoking, poorly controlled high blood pressure, high cholesterol, diabetes, lack of physical activity, or even diet. So we advise our patients to make sure they follow up with their primary care to make sure these things are well maximized to reduce the risk of stroke.
Dr. Ilorah, I mean, we know that if someone is suffering from a stroke, seconds count, and you just hope someone is nearby who can recognize the signs of a stroke. So for someone who might be watching, what signs should they be looking for?
So the signs to look out for are sudden onset of weakness on one side of the body, like the face, arm, and leg, sudden loss of speech, loss of vision, or even balance, and sometimes severe headache. So when you have any of these signs, that's the time to call 911 to come to the hospital for optimal treatment.
We know people can recover through therapy, but what is a thrombectomy? I want to say thrombectomy. Am I saying that right?
Yes. So thrombectomy is a minimally invasive procedure where we use tiny wires and catheters and go from the groin all the way to the brain to take out blood clots. If someone has a stroke that has like a blood clot blocking the blood vessel to the brain, so we do these minimally invasive procedures to pull out the blood clots, which has shown to improve outcome.
And if somebody does recover, what about the risk then of another stroke or possibly even impacting the heart? What should people keep in mind if they have had a stroke?
So once you have a stroke, there's always a risk of having another one. So one of the things we try to do is to first of all find out what caused the stroke and then try to maximize treatment to prevent that. For instance, if someone has irregular heartbeat like AFib, they'll have to place the patient on a different type of medication like blood thinners to reduce the risk of having another one. If it was due to blood pressure, we'll make sure you follow up with your primary care to maximize treatment of blood pressure, likewise diabetes and other diseases. So we'll try to find out what caused the stroke and try to maximize treatment to reduce the risk of having another stroke.
Dr. Ilorah, we heard it recommended in the past that, hey, maybe get on a low-dose aspirin per day once you're over a certain age or you have a family history of stroke. And then we've heard, no, you only do that unless your doctor maybe advises you to get on that kind of a program. What does the research say now about low-dose aspirin?
So low-dose aspirin has been shown to reduce the risk of stroke, especially the blockage type of stroke called ischemic stroke. So when you have a stroke in the past, being on low-dose aspirin has shown to reduce your risk of having another stroke in the future.
Okay. All right. Well, that's some great information this morning. Dr. Ilorah, we do appreciate it. He's with Brookwood Baptist Health, a neurologist there. Thank you, sir.
Thank you for having me.
All right. JJ is standing by.